following the fluid. That's always, the needle's always in the fluid. Because once you run out of room here, you cannot push the air back up into here because then you're going to break the seal and all the medication is going to pour out on you. Right? This is the only one that you can go ahead and withdraw all the medication and then get rid of your air and your air bubbles. Okay? This is a Z-Track, so I'm either going to use a filtered needle to withdraw the medication, and if I go ahead now and give this to the patient and I don't want it to irritate the skin with this needle, I'm defeating the whole purpose of the Z-Track because this needle is covered with the irritating medication. So I want to cover it, twist it off, get rid of it, and get a brand new needle and put that on before I give the injection. All right? Also, there's a little extra insurance policy that stays locked in the muscle. I want to pull down 2/10 and give an airlock. Okay, the airlock will be on the top, not on the bottom. You want to see the airlock on the top. When you turn it over to give the injection, then the airlock will be on the bottom, and that'll be the last thing going in. Okay? Go into your patient, same thing. Push the muscle over. Clean the area. Remove the top. It's an IM, so I'm going at what angle? 90. Steady. Have to do what to make sure it's in the muscle? Aspirate. No blood. Inject. Count 10 seconds. At the same time, your hand and the syringe come up. Shots container. Gloves off, hands washed. I'm going to take my gloves off every time because I'm wearing the same pair of gloves. I'll never get back on again. All right. Those are your IMs. Insulin. You have to know the normal blood sugar before you can give insulin. If you don't know the normal blood sugar, you cannot go on and give insulin for this skill because you're going to kill your patient. Normal blood sugar is 70 to 110, 60 to 110, and that range is fine. I just don't want to ask you what the normal blood sugar is and you tell me it's 220. All right, so let's say 60 to 110 is the normal blood sugar. Insulin drops your blood sugar. So you go in, you take your blood glucose level right before you give insulin, and it's 40. You're going to give it?
No.
No. Okay, you go in, and if you know, many patients get standing orders of insulin. Every morning they get insulin before breakfast, every evening they get insulin before dinner, and that keeps their blood sugar between that normal range. So you go in, morning dose of insulin, your patient's blood sugar is 80 within the normal range. Do you give the standing order of insulin?
Yes.
Yes, because that's what's keeping it in that normal range. Okay? This is an insulin syringe. It's not measured in cc's or milliliters. It's measured in units. 1 unit is quite smaller than 1 cc. So you cannot use a syringe measured in cc's to give units of insulin because you're going to be overdosing your patient. Okay? Again, these are vials. I have clear, which is regular insulin, and I have cloudy, which is NPH. The clear is your quick-acting insulin, brings the sugar down quickly. Your NPH works like a time-release capsule, keeping the sugar balanced for a few hours during the day. All right? Doctors will give a mixture of both, one that works quickly, one that works a little slower. Okay? Doctor wants you to give 10 units of regular and 10 units of NPH. You want to take your NPH, your cloudy insulin, and just rotate the vial and mix it up so it looks cloudy. Clean the tops with alcohol. You're going to do your checks again on your vials before you use them. I'm going to put air, same amount of air, I'm doing 10 and 10. 10 units of air into my cloudy, into the airspace. This is really important that you write this down because this throws everybody off. Take it out. 10 units of air into my clear. Turn it over. Withdraw the clear. 10 units. Go back into the cloudy and withdraw 10 units, or whatever the doctor's order is. Okay? Air into the cloudy airspace. Air into the clear, withdraw, then go back in and withdraw the cloudy. The reason you don't want to have the cloudy first in your syringe is because you don't want this cloudy to get into this clear, because then this will no longer be clear, it will be cloudy. Yeah. All right? So just remember that. This has an additive added to it. that makes it slow acting and cloudy. If this gets into my quick acting, it will no longer be quick acting, it will be slow acting.
I don't know if that's bad, the cloudy. You know how you're supposed to check for cloudy?
Well, the expiration date, and just make sure there's no little black things or floating around in there.
Anything that doesn't look normal.
Right. Usually this goes really fast in the hospital. The insulin goes really quick. Okay, recap. Patient. Now we're going to do a 45 to 90 degree angle, depending on the size of the patient. Okay. Identify your site. Do your cleaning with alcohol. Pinch if you have to. 45 degree angle. Give the injection. Shops container. Okay. One more. Okay. Intradermal. Now the intradermal is one that's just going right underneath the skin. Again, I'm not giving a medication to correct anything. I'm giving a medication to see if there's any allergy or reaction to something. This is a tuberculin syringe. It's even tinier than this whole thing only holds 1 cc. The 3 cc syringe, if you remember, each tiny line was 1/10 of a cc. Each tiny line on this is 1/100th of a cc. So very small. Okay. Again, your vial, alcohol, wipe it, pull back the desired amount of medication the doctor wants you to give. You're going to first do that in air. Go in, put the air in. Just bent my needle. Okay. Go in and withdraw the med. Get out all your air bubbles. Recap, go to the patient. Find the site, clean with alcohol. Wait for the alcohol to look completely dry on this one because I don't want the alcohol to get onto the skin, just the medication that I'm giving. The bevel, the flat part of the needle, the very edge of the needle, the flat part should be pointed up towards you. You want to go in at a 5 to 15 degree angle, right under the skin, pull up, give the medication, and you should see a little blister form. It's not going to work. I just brought you some water. It's not really medication. You should see a bleb form or like a little blister, and that's what you're going to circle because you need to come back in 48 hours and 72 hours and check to see if there's reaction to that. I'm letting you practice with these. I just ask that when you finish practicing, just take this layer off so that it dries. Okay? And that's it. Sharps container. Any gloves off, hands washed, document. Alright, that's it.